In today's video, we're going to be talking about 4 reasons why the forehead is such a hard area to unwrinkle. It's actually one of the most popular areas to treat on the face with anti-wrinkle injection, and also one of the first areas that is taught. And the way we're taught this area is really unusual. For example, don't inject over the brow, only put in a couple of injections in the forehead, and really we were getting some really unusual results. The forehead was moving in very unnatural ways, the brows were moving in unnatural ways. And it took me quite a while to undo the initial teachings that I was taught. Over the years, I've been refining my techniques with the forehead, and I wanted to share with you some insights about how you can do anti-wrinkle injections to the forehead. So maybe if you're thinking about getting this done, or maybe you've had this done, or maybe you haven't got the exact results you want, hopefully this video will give you some insights into how you can get it done in a natural way, which looks really good. Still, for me, the hardest area to inject with anti-wrinkle injections, and that's because it's really difficult to find a balance here. The forehead has one muscle in it which elevates the eyebrows, and that's called the frontalis muscle, and its sole job is to raise the eyebrows. So it gives us expressions such as surprise or maybe mild disapproval. If you have excessive movement of this muscle or overusage of this muscle, then you are going to get some wrinkles. So the forehead muscle, or the frontalis, elevates the brows and also opens up the visual field. So it does have a good purpose. We just need to sometimes temper its activity so that we don't get too many wrinkles. It's a very fine balance. So let's get into the 4 reasons why the forehead is so hard to treat with anti-wrinkle injections. Okay, the first reason. Now, I've got a bit of this issue happening. So the first reason, and probably the most important reason why the forehead is so hard to relax or treat with anti-wrinkle injections, is because invariably most people after the age of 30, 35 start getting heaviness in the eyelids. It can also be a genetic thing. Now, if you think about the action of the frontalis muscle, the forehead muscle, it is to elevate the forehead. So any amount, even 1 drop of anti-wrinkle injection, will cause the brows and the eyelids to fall and become heavy. So this is a real tricky balancing act. If you don't have a lot of excess skin in the upper eyelid, then really it's fine. You know, these patients are the easiest ones to treat, but it's not that common that you see someone with virtually no excess skin there. It's a real common issue. So with someone with heavy upper eyelids, we have to really moderate our dose. This means that you're not going to get as much relaxation of the forehead, and hence you're not going to be able to completely remove all the wrinkles there. Furthermore, because the dosage that you can inject is limited in the forehead, this means that your longevity won't be as good in the forehead. So really, a lot of the time what I'm doing for those with heavy upper eyelids is putting in maybe only a half of a usual dose, which might be in the order of, say, 5 or 6 units, for example. And you're not going to get much longevity there. It might only be, 6 to 8 weeks, for example. But I think it's important that you explain to your patient that this is a limiting factor, and you have to make a compromise. If they have heavy upper eyelids, then you can't put in a big dose. You just have to reduce your dose, explain to them that if we put in too much of a dose, they're going to get a lot of heaviness, and if we don't put in as big a dose, the longevity will be affected. So how do we get around this issue? There is a little trick that you can do to inject the muscle that pulls down the brow. So this is called the orbicularis oculi muscle, and it's just beneath the brow here, and you can inject it around here, and you can see when I close my eyes tightly, the brow descends. Let me get you a diagram of this. Here we go. It's this muscle here, which you can inject. You see it's a downward pulling action. So by injecting it, you're releasing it. So I like to think of it like a tug of war. If you're going to take a few members off the tug of war team, which pulls up and make it weaker, you've got to take a few members off the tug of war team, which pulls down. That makes that team weaker. So you're really balancing out this tug of war. By putting some anti-wrinkle injections just under the brow, you're actually able to balance the pulling forces of the frontalis muscle and the orbicularis oculi muscle. So you get a bit of support and maybe less brow or eyelid heaviness afterwards. So the next reason why the forehead is hard to treat is because people always invariably ask for a brow lift with no wrinkles. So they want to relax their forehead and reduce the number of wrinkles there, but at the same time they want to have a brow lift. So these two things are contradictory. You can't lift the brows by relaxing the forehead muscle. So there is one way around it, which I'll say up front I think is a very bad solution, and that is to leave the areas just above the brow, so you don't inject anti-wrinkle into these areas. And this is what they teach you in your very first Botox lesson, I think in an effort to help avoid brow drop, but in fact it really ends up with a very, very poor result. I've actually done a whole video on this, so you can watch the video on how to have anti-wrinkle injections without looking like Dr. Spock. But the reason why this is such a poor outcome is because by leaving this area above the brow, you're actually getting spiking up of the brows just at the tail ends like that. And you end up with this wrinkle, so you're basically leaving the muscle activity just above the brows, and it looks very odd. In fact, to me, this is one of the key signs that you have had Botox treatment, and it's a giveaway. So anything that divulges the fact that you've had a cosmetic treatment done, probably means that it's not a good cosmetic treatment. Remember, all cosmetic treatments should be undetectable in a sense, so you shouldn't be able to pinpoint exactly what's been done. And to me, this is a dead giveaway. The other thing to remember also is that lifted brows are not a sign of youth. So everyone asks for a brow lift, and I think it's because most of my patients will tend to be, getting to that age where they're starting to get a little bit of heaviness in the upper eyelid. So they're going to ask for a brow lift. But we have to remember that naturally the brow does elevate with aging. So as we get older, we get heavier eyelids. The brain compensates by telling our forehead to elevate. And usually by the time you're 80, your brows are halfway up your forehead. So it's not a sign of youth to actually have elevated brows. Look at teenagers, for example. They never have elevated brows. They usually have very, very low brows and almost some puffiness to the upper eyelid. So I always try to re-educate my patients to encourage them not to have a brow lift. I don't want to cause a brow drop, but I don't want to encourage them to have a brow lift with anti-wrinkle injections. So the solution to this problem is more about expectation management. You've got to tell your patients that forehead wrinkles and brow lifting are two incompatible things that you can't have together. But then again, it's not necessary to have a brow lift because that is not a youthful appearance. Here's the third reason why the forehead is such a hard area to treat. A lot of people who have static lines, that means lines on their forehead that are etched in, that are there even when they're not raising their eyebrows. These are the people who you'd think would need anti-wrinkle injections the most, but they are the least suited to having anti-wrinkle injections. It's a bit ironic here. The people who possibly need it the most or seem to need it the most are the ones who actually can't have it as much. And the reason for this is that by the time you have etched in forehead lines at rest, you have developed a degree of what we call hypertonicity of the frontalis muscle. That means basically that your brows and your eyelids have dropped with aging, and to compensate, your brain says, raise up your eyebrows, contract that frontalis muscle. It gets into a constant state where the frontalis muscle is in constant contraction. So this of course causes severe etching of lines. I have patients who I see with this concern, and I ask them to close their eyes and try to relax their forehead, and a lot of the time, even with eyes closed, they can't get their forehead to relax. So for these people with etched in forehead lines, the treatment is most commonly not Botox. Basically, they are poor candidates for Botox. These patients need to have the underlying cause of their forehead lines treated, which is, in this case, heaviness of the upper eyelid. So a blepharoplasty is what is required. That is removal of some excess skin of the upper eyelids. And in fact, in the Journal of Plastic Reconstructive Aesthetic Surgery, they showed that those having blepharoplasty actually had reduced frontalis EMG activity, that is, reduced muscle activity in the frontalis muscle after having surgery to remove upper eyelid excess skin. If you have etched in forehead lines, a blepharoplasty may be something that you need to consider. The other workaround is to have filler instead. You can use filler in two ways for this. Firstly, you can do filler, so putting very, very small droplets of filler into the line, drop by drop, and basically lifting that wrinkle up. So you only can put in tiny, tiny bits when you do this, and it has to be done very carefully to avoid lumps. The other method of using filler for this is to actually revolumize the forehead. So volume loss in the forehead is also a cause of wrinkles, so it's like a beach ball deflating. You can actually inject filler into the concavities of the forehead to re-expand it, make it into a more youthful convex shape, and also at the same time reduce the amount of wrinkling there. The fourth reason why the forehead is very hard to inject is because it's actually a very big, wide muscle. It's super flat and wide, covers the whole forehead. And I remember, traditionally we were always taught to inject about 5 injections, or probably 5 or 6 injections in the forehead. And really most of the time you can't cover the whole forehead with only that few number of injections. You're going to miss spots, and what will happen is that some bits will be flat and smooth and some bits will be moving. So you've got to put in a lot of injections, and that is the key. Spreading the Botox throughout the whole forehead, putting usually very small doses in lots of different positions. This is a typical syringe used to inject Botox with, and to inject, say, half a unit in 10 injection points, or a total of 5 units, it would be extremely difficult. That's the amount that you have, and you have to break that up into 10 injection points. So you can never get it even. If you want to inject very small amounts in a large number of points, it's going to be extraordinarily hard, because no one has the motor skills or the eye to see how much they've injected along those little lines. I've got a fix here again. And here's my fix. I get a syringe and a needle and insert it into this gun. And using this gun, I'm able to inject just the tiniest amounts in each injection point. And I can do this with absolute precision. I can put in the smallest dose and the same dose in every injection point if I choose to do that. Because we're giving so many injections, people worry about pain, but this gun halves the pain. That's my little secret for forehead. Okay, so enough talking. So to demonstrate some of the principles, let's get on and do a live treatment of a patient right away. So here we are. We've got our lovely patient here, Kim, who has volunteered to be
from a Facebook page.
Yes, she answered our Facebook page post to be a model for this video, so thank you for coming in.
Thank you for picking me. I was surprised.
Tell me what your concerns were with your forehead.
Last year, I suddenly felt I suddenly looked old. Yeah, I've not really paid much attention. I'm not an overly vain person, but the last year I really noticed that I don't look like I feel, and I look a lot older than I feel.
I see. And how does your forehead contribute to that feeling?
It's the main focus, and at work I get a lot of comments about I'm the old lady of the dance hall. I work as a barista, so I make coffee, and people are looking at me all the time. So
if we can help smooth out these lines a bit for you, that would be fantastic. Give you a bit of a boost.
It would give me a great boost, it really would.
So For Kim today, we're going to be doing some smoothing of the forehead. And also, before we do that, we're just going to have a close assessment of her face and go through some of the principles we spoke about earlier. Let's have a close look at your forehead, Kim. You have actually got a little bit of tension in there. Even when you're not trying to move, which I don't think you are right now, there is a little bit of contraction of that frontalis or forehead muscle. And if we look also at the upper eyelid, you can see there's some excess skin there. And what is happening is that your forehead is contracting to actually compensate and open up that field of view and get that skin out the way.
Yeah.
Do you ever notice you feeling heavy in the eyelids?
Yeah, I can feel that, yeah.
So we have to be very careful of treating Kim with anti-wrinkle injections, because what we can easily do is decompensate her. This is for her a compensatory mechanism to help open up her field of view. So we mustn't take away too much from that, and we must allow her to still have some activity in her frontalis muscle. That is, she still must be able to contract. Otherwise, she's going to come back to me next week and say, this is terrible. I feel heavy in the brows. I can't wait for it to wear off. And I certainly don't want that for you. So it's going to be about moderation. So what we need to do is look at other strategies of improving the forehead as well as anti-wrinkle injections. So we'll have a look at that today. Also, if we look at the forehead, we can see that there is some static lines in here in the forehead and also in the frown area. So these lines are etched in, and like we said in the video, it's actually very hard to treat someone with etched in lines, because that's an indication that they've got that constant contraction.
I'm trying very hard not to do it. I can feel myself doing it, and I'm trying not to.
So you're actively trying not to
do that.
To frown or to raise your eyebrows.
It's harder to not do than to do. That's what I'm finding.
What we'll do today, we're going to put mild to moderate sort of dose in the forehead of some anti-wrinkle injections, and then I'm going to go in and actually put in some filler, some micro injections of filler into the forehead lines. Okay, so should we get to it? Let's do some injections.
Let's do it.
Okay. First step, some antiseptic on the forehead. Next step, to avoid bruising, we find the veins with our AccuVein.
It's like a stud finder on the wall.
It's like a stud finder.
You know?
So there's some significant veins here, which if we hit would result in some pretty good bruises, but hopefully we can avoid them. Planning is the most essential part of this procedure, and we've got to work out where we're going to put all the little injections. We've got our trusty gun.
You need to duck down and pop up with a white hat and your gun. Pop up with your little cowboy hat and your gun.
We have the gun. Oh, I don't have a cowboy hat. So we've got our anti-wrinkle injections here. Our gun. Let's see.
Wish you luck.
Wish you luck. Okay. Are you ready?
Nothing.
You feel nothing at all. Isn't that amazing?
Like it just, like a little cold but no prick, nothing.
No prick, yeah.
No. It's great.
Ready?
Terrific.
How's that?
That's too easy.
Too easy. Next step is to do the fillers, and before we do the fillers, they're a little bit more painful, so I'm going to put a bit of local anesthetic in here, which will numb you from your eyebrows all the way to the middle of your head there, the scalp. For about half an hour.
Brain
the brain,
too?
it doesn't name the, no.
All
You need something else for that, not local anesthetic.
Okay.
Now I've got my vibrator here, which helps to reduce
I'm not saying a word.
It helps with pain.
Great.
Okay, close your eyes and relax. Here we go. Now you feel a little injection. Now, actually what we have here is a little bit of filler. So it's been put into a very fine syringe and needle, and we can't do this one with a gun because it needs to be done very delicately with sort of precise force. So just enough to lift the wrinkle up and not cause a lump. So that can only be done by hand. But hopefully you're getting a bit numb here, so you won't feel that.
Yeah, I am.
Yeah, I'll start up here. What I'm doing here is I'm putting some tiny drops of filler into the fine lines. And this is just normal filler. I don't...
Not spec filler.
Not spec filler.
For painting. When you said normal filler,
I've got this,
I instantly thought of spec filler on painting the wall. I'm sorry.
We used a stud finder before, and now we're using spec filler. We're just going to clean you up now. What we'll do is we'll bring you back in a week or so, and we'll see how your progress is.
Stay tuned, folks.
Hello, Kim.
Hi, how
We're
are
back.
you? I'm back.
We're back, and
In pog form.
in pog form.
That's an old thing. That's an old thing for chips. It's all right.
What's an old thing for chips? I
There was an ad. We're back in pog form, and they're little pogs and they're little discs like you flick.
Oh.
They're like a little kids game.
But look, I got some cool pogs. Elf pogs. Remember Elf? He's back in pod form.
Anyway, cut that out.
Cut that. No one knows that.
Pog.
You're showing your age by saying that.
Well, look what you've done.
Well, look.
How old am I? Guess. Yeah.
Don't tell them that. They'll guess. Okay. If we look back at the old pictures and have a look at your forehead, it's like a completely different forehead.
No.
I've noticed that you've got less movement. That's a really important point.
Yeah.
So it's important that your patients don't feel overly heavy or paralyzed in their forehead afterwards. And I think that's made just enough difference to temper the wrinkles, but not too much so that she feels really heavy. That in combination with the fillers has been an excellent combination to help really smooth the forehead lines. So what a difference. We hope to see you all again in our next video. Thanks again for watching. I'll leave you with some of the bloopers that we filmed.
Some of our funny moments.
Yeah.
He's
Anyway.
a funny guy. He really is.
We had a good time doing it, didn't we?
We did.
Yeah,
Yeah,
that's
we
good.
did.
All right. Catch you next video.
Thank you.
See you. What do you reckon, Kim?
Look,
Maybe I should be
isn't it
turned.
supposed to be up here?
Hello, my cosmetic friends. Today I'll be talking about the... Hello, my cosmetic friends. I'll be talking... Hello to all my... Not bad.
As good as it's going to get. Come on, there's the bit of this angle.
Oh! Is that better?
For you, yeah.
All right, I'm going to put it up.
See, there's that shaky hand.
There's that shaky hand, watch out. And also, sorry, I don't know what I'm saying, Kim. We've got to have a balance between...
I hope you know what you're doing.
Yeah.
I'm sorry.
I hope so too. I hope so for your sake.
I'm so sorry for the best, fingers crossed, people. Yeah.
Okay, so should we get to it? Let's do some injections.
Let's do it.
Okay, great.
I'm ready.
Let's do it. Okay.
So ready.
So ready. It's going to be a good video. I like it already. All right, I'm going to have to lay you back, I think, because I can't really...
Of course, they all say that.
I can't... What's that mean?
See, I told you when I get nervous.
You're very high up.
Oh, right, yeah, no, I wasn't going to jump.
Yeah. Some people do.
Send me out here with a broken leg. We'll take care of you.
All right, all good.